Hello, everybody. I am here to do a lecture on chapter 2 of our book for Social 11. Bring that up for us. Okay. All right. So chapter 2, the history of the social welfare system and the social work profession. I should start by saying that if you have looked at the PowerPoint for this chapter, it's going to have some slides in it that I'm not going to go over, just because they're covered much more thoroughly in your book than I could do, and I just didn't think that that was a great use of your time. So I will talk about those when I get there, but we should be able to work through this fairly quickly, I think. Okay, so the social welfare system helps people kind of, if you view it from kind of an umbrella way, social welfare is the umbrella, and then the social welfare services are all the things that are underneath the umbrella. So the services are just, they're never perfect. And like the reason why they're not perfect is because every person is different and comes to every situation with different needs. So no service is going to meet the needs of every person, right? And also because um, services don't change as quickly as we necessarily need them to. So, there's always this push-pull in social welfare services, any service and any sort of like, entity that does anything really. There's always this push-pull between being dynamic and flexible and having norms. So if you think about it in terms of the government, most social welfare services in this country are government services. Well, that's not entirely true, but most very large ones, I would say, are government services. And the thing is that government systems change slowly, and we want that to be true. If government systems were easy to change and changed quickly, then they would be at the mercy of any political wind, right? And as I record this in January of 2021, I think that you can think of why that's not a great idea, why you want politicians and government systems to be able to have to go through multiple layers of effort to change services that are offered. So there's this trade-off, right, between making things as useful as possible and flexible to the needs of people, and also making them robust enough to withstand pressure. Okay, so there's kind of two types of services, and they're kind of preventative versus reactive. And so the first type is institutional services. Those are the preventative ones. They're the ones that are there to prevent problems. These are primary interventions. They're available to everybody. So I like the example of public education as the institutional services. You're not solving a problem. You are providing a service, and by providing that service, you have prevented problems. Residual services are designed to address issues that exist, so real problems. So they help with poverty, which is TANF, food stamps, that sort of thing. They, services in schools for disabled children, right? So those are residual services because there is an identified need. Okay, So these are the slides that I am not going to cover. If you download the PowerPoint that I uploaded to Canvas, you'll see all of these slides. They're not particularly helpful, but they take you through every time period of social welfare services. So go and make sure that you understand those, because it's all in your book and everything, and you are going to see it on your quiz and your exam. Okay, so there are a lot of social welfare programs that are administered by the government and by private agencies, but they fall into some general categories, and so cash assistance is the most simple to understand. You're just literally getting some cash to help you out, and you do whatever you need to do with the money, and there's pluses and minuses to this. And one of the minuses that is really, really important to think about from the perspective of social work is empowerment, right? So we talked a lot about empowerment during the chapter 1 PowerPoint. And the thing is that if we're dedicated to the idea that clients control their own destiny and are in control of their own course, then we want to give them as much control over what it is that they have as possible. On the other hand, right, you can picture a lot of different ways in which folks who are in need are not necessarily in the best control of themselves, right? So, there's two parts to this, and you're never going to get away from that. You're never going to get away from the idea that as a social worker, you're going to have to do a lot of work to kind of figure out how much support somebody needs versus how much independence, how much control over what it is that the course of the services that they get. So that's always going to be there. Okay, so in-kind benefits, food or housing. So we're talking here about like, for example, the food pantry. Entitlements. So, like these are for folks who meet certain requirements, whether or not they necessarily, are institutional or residual. So, for example, like the GI Bill, right? So for folks who are veterans and get educational assistance, that's an entitlement. Okay, so public assistance programs. Programs that are designed to alleviate poverty, they are means tested. And again, there's some real problems with this because not every family is created equal, first of all, and what one family might do fine on, another family is seriously struggling. And then the other issue is that the lines for poverty are so sort of ridiculous in this country. They're so very low that there are a lot of folks that fall into the gap in between where they are means tested into a particular program versus can actually afford the service. So, for example, the Affordable Care Act provides completely free healthcare for folks who meet certain income requirements. Well, there are a lot of people who don't meet those lower income requirements to have their healthcare fully subsidized, but at the same time, they don't have the income, they don't have the means to pay the premium. So it's a problem, and a lot of programs have that sort of problem. Okay, so social insurance. Oh, no, wait, there we go. Right. So I want to talk a little bit here about these two types of organizations. I'm sorry, two types of groups slash organizations you'll see as we go on, that have really influenced the history of social work. So the first one, the charity organization societies. So the idea here is that you have an individual, right? You have an individual, and essentially they need to be fixed. If you fix that person, then whatever the problem was is fixed. And you would do this by basically proto case managers. So first of all, let's talk about what level of approach this is. So last week we spent a lot of time talking about Bronfenbrenner's ecological systems theory and the levels of the system. And I want you to think about that kind of visualization, that diagram, as we think about this. I mean, if the issue is from the perspective of charity organization societies that the individual has some sort of problem, then there's only one way to fix it, which is to somehow modify the individual. But how do you modify an individual? Like, what do you actually do to modify an individual? Well, if you think about how we change and how people change, it is, and I'm talking in very general terms here, basically through relationships and basically through, working with other people or other systems, or like even if you're doing, a series of self-help books or something, somebody wrote that book, right? So, we can't neglect the system, right? And if the entire system is this friendly visitor thing, then there's not a lot of different ways to affect change. The strength of using the whole ecological system is that there are a lot of ways to intervene, right? There's a lot of ways to affect change. So, when you just narrow it down to like the individual and like this one person who comes and hangs out with them, you can see what the problem is. So the settlement movement goes basically completely the other way, right? It's basically about how you kind of ignore the individuals in the situation and you just kind of focus on the larger environment. Well, you have the same problem except in reverse now. So when you ignore individual circumstances and individual strengths and individual areas of development, you are leaving out a big piece of what is needed for change. So, it's all well and good to try and shrink the gap between rich and poor. That's great. And we do need systems for that. And if I had to pick one of these two philosophies to go with, it would be this one. But, you do need to have systems and interventions on both levels. You need to have systems and interventions that work with the individual and systems and interventions that work with larger, the bigger parts of the circle, right? So, bigger parts of the system, right? Okay, so like I said, we went through this very fast. But the history of social work is basically the history of push pulls between change the person or change the system, who's worthy of helping, who's not worthy of helping, whether that worthiness is related to religiosity or not, and whether helping people should fall to religious institutions or to the state. We didn't talk about this very much today, but it will come up quite a lot as we go forward. Is the job of the social worker to be objective, or is it to be an advocate, right? So that there's a lot to talk about there. helping people we know versus helping strangers. So is the question like, work in your own neighborhood, do your work in your own neighborhood, or, go and see where your effort or your money or whatever can do the most good, regardless of where that happens to be, or where it does the most good that speaks to you, right? So like, I don't know, the orphans in, Africa or something might speak to you more than the kids in foster care down the street. Okay, but that's part of the push-pull of the system. And then crisis versus ongoing need. This is a little bit, has somewhat to do with how much of an adrenaline junkie you are. Working in crisis is very hard to do, but it's also very short-term work. You work through the crisis, and either the crisis is completely resolved and that's that, or you pass that client on to somebody who does sort of an ongoing needs type work with them. So there are a lot of push pulls in social work. There's no right or wrong answer necessarily about any of this, but they all require conversations, and they all require you as a social worker to think carefully about what your values are, so that when you go to work, that you know what it is that you want to do, what you want to focus on. Okay. All right, so if you have any questions, please come to office hours on Friday, but you can also email me your questions. I would be happy to do a recording or to write an announcement or whatever, as always. Okay, thank you very much, and let me know if there is anything that I can do. Thanks.